I'm Paul Propson. I'm CEO of Covenant Community Care, and I've been here for 12 years. Well, my greatest pleasure is to serve the board of directors. This is a group of volunteers who have set out to create a medical, dental, behavioral health home for our community to make sure that anyone who is in need of health care in the Detroit area is able to get it and never finds a lack of money to be the reason why they don't get healing. We are blessed to have great doctors, dentists, nurses, and a team of people who really give sacrificially by working to serve their neighbors. That's our primary donor, is really the team of people who come and serve every day.
We provide multiple services, including treatment of eye infections, eye inflammations, with a specialty in working with special needs patients, people who are legally blind, partially sighted.
So many patients come to us, they're referred from the emergency department sometimes, or urgent cares, and patients don't have primary care, and luckily we really try to be open to the community as much as we can.
Also, I think it's unique that we are a faith-based organization, that we're offering that spiritual support as well, because a lot of times that is what's lacking in a patient's life when they come in. A lot of times it is that they need that spiritual support, emotional support, and that's where our behavioral health come in.
Each of our sites has at least one counselor, and we try to check in on patients who might be feeling stressed or anxious or depressed.
In and around roughly 50% of people who come into a primary care visit are struggling with a depression, anxiety, adjustment to something.
If they have habits they want to change, addictions they want to work on. So we really just try to meet them where they're at and get them pointed in a direction where they want to be going.
Centering pregnancy is very much education and saying, you're not sick, you're pregnant. So let's stop treating you like you're sick. Let's treat you like you're about to be a mom. Being together has been like, oh wait, that's their prenatal care. They're not alone, but they are in a group with other women. They're experiencing their pregnancy together, and it's really fun to be able to be a part of their journey.
I think it's been really incredible to see, God grow the people, not just in numbers, but just the quality of people and the heart of people that want to be part of a mission. It's been fun to work with people and to hear their hearts, to see their passions, to see that play out. Like inpatient care and new ideas, whether it's OB care, the recovery center, homeless outreach.
What we do is we go out every day and try to help people who otherwise wouldn't be able to get medical care, help them to get the primary care that they need, and then inevitably the specialty care that they need. The real obvious barrier is transportation, and only 25% of households have access to a car. So we will take them not just to our doctors, but we will take them to other places they need to go to try to improve their lives. So, getting off the street is the best thing for people's health. So the best health care is not being homeless anymore.
So in 2008, when I first arrived, I came to West Grand Boulevard, and there were 3 dental chairs, no dentist hired, no staff hired. So we literally built dental from ground up, starting in 2008, and we now have grown to 2 fixed sites with 6 chairs at Maroth and 9 chairs at Michigan Avenue, and a mobile dental program.
We have our OS residents here, and we have doctors that do a lot of cosmetic dentistry. They do root canals. Instead of referring out for everything, a lot of our services are offered right here in-house.
We had all the specialties working together. We had the orthodontist, we had the oral surgeon, we had the general dentist.
No he tenido nunca mala experiencia, no. Solo buena experiencia, me han tratado bien.
Me being here and being able to hear that every day, because you know that what you set out to do that day, you've accomplished something, at least with one person. If it's not everyone, but at least with one person.
Me cambiaron la sonrisa. Antes no podía sonreír bien por miedo, timidez, y eso, y ahora me siento como más confiable.
Smile can mean everything to someone, and when you're embarrassed to smile, you may not have the confidence to go out and get a job, to look people in the eye, so we're able to transform people's smiles.
Muy buena porque nos ayuda a nosotros.
We could do more right where we are, and we should, at Michigan Avenue, at Maroth on the east side, at Woodward and Royal Oak, at Joy Road and Southfield Freeway. We need to do more in all of these locations, and we will. How do you decide what to do next? We don't have a view that we know the right answer. God will reveal the answer. That in many ways, God is going to work through the community. That's why we have a community-based board of directors. That's why we listen to our staff and we listen to our community and our partners. So for example, we had the opportunity from a hospital, St. Mary Mercy Livonia, saying, we'd like to see the people in the Westland community who are in need of health care to have a primary care provider. Would you come and open a site in Westland? So we took it to God and we said, Lord, if you would have us do this work, bring to us a leader who can serve this community. And God brought us Dr. Jeff Ghioto. And here is a man who can serve the community in Westland with showing and sharing the love of God as seen in the good news of Jesus Christ.
Well, here in Westland, we're going to be starting off with primary care, family medicine, and providing all aspects of, primary and preventative medicine, well visits for the kids, complete physicals, cancer screenings for adults, men and women. We will be bringing in more providers as time goes on, to meet the needs of the community. But we have spaces already designated for when we will have behavioral health available. Our core mission is to, spread the love of, Jesus Christ to the people of Metro Detroit by providing them with quality health care. And, our clinics, they're clean, they're bright, they're comforting. And it's, the whole reason for that is because we want people to really feel like they are human, that they are valued, whether they have health insurance or don't have health insurance. Everybody deserves, medical care. They deserve to feel like they are valued, and we treat every single person the same way. And you see that as soon as you walk in the front doors. We promise we will do everything we can to take care of somebody in the way that a person should be cared for. We want to share that love of Christ with our patients, and and really not ask for anything in return except for just knowing that we've done something to make a difference in someone's life.
I remember when we first invited Covenant kind of to the table, just being so excited to see what they were already doing, the high level of dignity that they do what they do. It really is amazing, the level of care, the dignity of care, the way they treat the patients, the customer.
There's one particular individual always sharing a testimony at church. She has gone to different medical centers to try and find care and been turned away often, whether that's because of financial reasons or insurance, and she's always found a yes at Covenant.
It's a perfect fit for who we are as a church, and being able to have this well-rounded ability to reach the community and to tell people about the love of Christ.
It's definitely special. Their ability just to welcome anyone and everyone in the door, I think, is something that's unique nowadays, particularly in medical care, without having to run through the whole gamut of questions. They're just like, come in and we will see you. The answer is yes, right? We will see you. And that's really valuable.
I would just say that there isn't a better cause happening in the city right now. There isn't a group of people that are on mission and doing it as well as Covenant, and it's worth your support.